Jennifer Temby, and I'm one of the RNs here. Nice to meet you. Do you mind if I just put this down here? Okay, great. Professor, normally I would never put my clipboard or personal items on the patient's bed, but just for lack of space and for the video purposes, I'm just going to utilize the bed space as a table. I'm just going to clean my hands. And may I have your name and date of birth? Millie Larson, January 1st, 1936. And I'm just going to check your ID, ma'am, if that's okay? Okay, and that's the same. And any allergies? No allergies, perfect. Professor, so I'm just going to move the arm closer to you. And let me just bring this kind of close so you can see. So I kind of went on Excelsior and got the paper of the arm, and I have my ID band, and I have it set up and with a Tegaderm. So I'm just going to put that down here so it's closer in the video so you can see. Okay. Also, I just want to show you my supplies. So I have my biohazard container. I have medium gloves, paper tape, hand sanitizer, alcohol prep pads, 2 normal saline flushes. They are 10 ml each. I have a 3 ml syringe. I have a hypodermic safety needle, which is 25 gauge, 5/8 of an inch. I don't know if you can see both sides. And then I have Furosemide. It's a 100 milligram vial. It is 10 ml and it is 10 milligrams per ml. And the expiration date is October 2029, so it's still within good time frame. And the doctor's order is Furosemide 20 milligrams IV push every 12 hours, administer over 2 minutes, flush with 3 ml of normal saline before and after dose. So for this purpose, we are only going to use 20 ml as that equals, 2 ml as that equals 20 milligrams. Also, while we're here on the furosemide, I want to say my first check was done as I pulled the medication before entering the patient's room. I checked it against the doctor's order in the MAR. So that was my first check. Okay. So Mrs. Larson, I just want to explain to you what the doctor has ordered today. He has ordered a medication called Furosemide. Have you ever heard of that? No? Okay. So this medication is a diuretic, and what it is going to do is it's going to help you get rid of some of the extra fluid in your body, which is going to help reduce the swelling in your legs and lower your blood pressure. Now, I know you said before no allergies. Just want to verify again. Now, this medication, I'm going to give it through your IV, so you don't have to take any pills and you don't have to have an injection. How does that sound? Good? All right, so we're going to get started. So my hands are clean, Professor. Just going to put on gloves for this part. Now I want to get rid of the excess mLs in these flushes. They are 10 mLs and we only need 3. I have a trash bin on the floor. And I also want to make sure that the air is out, and I definitely see some air in here. So I'm going to just leave 3 mLs. Okay. Just getting out the excess air. Okay, so I have 3 mLs. Don't know if you can see that. Just going to put the cap back on. And I'm going to do the same to the other one. Again, just removing the excess. Okay, again, just 3 mLs left, and we took the air out as well. Before drawing up my medication, I want to just label the amount. Here is where I'm going to do my second check. So it is, I have the vial in my hand, and I'm putting it against the MAR, so Furosemide, 20 milligrams IV push. And that is to be administered over 2 minutes. So I am just going to label my syringe with the name and the dose. So that is Furosemide, 20 milligrams, 2 mLs. And this is ready for when I'm done. I'm going to pop the top off. And I'm just going to open up an alcohol swab, and I'll just bring this closer so you can see. I'm just going to swab the top. Throw that in my garbage. I'm going to open the syringe and open the needle, and I'm going to attach these two together so I could drop my medication. So it is going to be 2 mLs. So I'm pulling back just so I could push air in. Now we are not going to use the needle, so I'm going to put the safety on it. So if you could just see, it's 2 mLs. I have the safety on the needle, as we're not going to need the needle anymore. Just throw away my garbage. Okay. All right. I'm going to put on a pair of clean gloves, sanitize my hands again. So Mrs. Larson, we are all set to go with the IV medication. Any questions? No, you've had something like this done before? Okay. Well, I'll walk you through it as we go ahead. And I am just going to look at your IV site and feel a little bit. So Professor, there's no signs or symptoms of infection or infiltration, so we are good to go. I am going to cleanse the IV port. Okay. And now we're going to use our first syringe of the normal saline flush. And again, I just want to check the doctor's order. Flush with 3 mLs of normal saline before and after dose. So attach it. And I don't know, Professor, if you could see it going through. Oh, maybe I'll see it drip, but just wanted to show you. Obviously, I would never do that, but just wanted to show you that it really is functioning. Okay. And that was done well. This is going to go into my biohazard. I want to just label my medication. Okay. So now, Professor, I'm going to do my third check. So I have my labeled syringe and I have the original vial. So again, this is going to be my third and final check. It is Furosemide, 20 milligrams IV push every 12 minutes, administer over 2 minutes. Okay. So at this point now, I can unscrew my needle as we don't need this. It'll go right into biohazard. And I want to just make sure I clean my hub. Okay. And I'm going to attach the medication. And we have to do this over 2 minutes, so all right, Mrs. Larson, this medication, unlike the saline flush, has to be done over 2 minutes, so I am going to do this very slowly. Are you doing okay? Perfectly fine? That's what I like to hear. Have you seen your family or friends at all while you have been staying with us? You did? Oh, that's great. You can't wait to get home to your dog. I don't blame you. Still doing okay, Mrs. Larson? So, Professor, I am just slowly administering the actual Practi furosemide, going very slowly, looking at my watch that has a second hand as to not doing it too quick, and I am about at the 1 ml mark, which is good because it's been about 1 minute. And Professor, I'm just going to remove my hand so you could just see I have it attached at the IV site. I just wasn't sure if my left hand was blocking you from seeing. Are you still okay, Mrs. Larson? Good, and we are all done. This is going to go into my biohazard container. Going to do another alcohol swab. Okay. And now we're going to do another normal saline flush as the doctor ordered. And again, Professor, this is 3 mLs because I already took out the extra as it was a 10 ml. Okay, biohazard container. Going to clean the port. This will be the last time we do that. Okay, Mrs. Larson, and I just want to take a look at your IV site. I'm going to feel. And there is no sign of adverse reaction at the IV site, Professor. There is no redness or warmth that I could feel, and no signs of infiltration. So the patient seemed to have tolerated it well. Of course, we will monitor throughout. All right, so I am done with this. Mrs. Larson, just going to clean my hands again. And how are you? You did okay? All right, perfect. I am just going to document that we gave you your medication. Okay. And, all right, perfect. And Professor, I just want to say that there are 6 rates for medication administration. So that would be the right patient, the right drug, the right dose, the right time, the right route, and the right documentation. So I wanted to mention that part. Okay, I'm gonna just put the arm back so it looks like Millie is back in bed where she belongs. And Of course, all my garbage I would have disposed of normally, and the biohazard container would have been on the wall. So Mrs. Larson, you did very well. I'm going to come back and check on you in a little bit. Is there anything I could do before I leave? Are you comfortable? You're comfortable? Great. And here is the call bell. Should you need anything, don't hesitate, and we'll pop right in. All right, I'll see you later.